1. The primary focus of person-centered therapy is A. Uncovering unconscious conflicts. B. Encouraging rational thought patterns. C. Creating a supportive and accepting environment. D. Behavioral modification. 2. Cognitive behavioral therapy (CBT) aims to A. Address unconscious drives. B. Challenge and change distorted thinking. C. Reinforce avoidance behavior. D. Focus solely on past trauma. 3. Motivational interviewing is especially effective in A. Treating psychosis. B. Encouraging behavior change in ambivalent clients. C. Managing cognitive impairments. D. Assessing physical disabilities. 4. The primary purpose of a vocational assessment is to A. Diagnose psychological disorders. B. Determine physical limitations. C. Identify appropriate job placements and training needs. D. Determine academic achievement. 5. The term standardized test refers to an assessment that A. is customized to each client's needs. B. Has uniform procedures for administration and scoring. C. Uses only qualitative data. D. Requires a doctor's referral. 6. When choosing an assessment tool, a rehabilitation counselor must consider A. Cost only. B. Client preference. C. Validity, reliability, and appropriateness for the population. D. Length of the test. 7. In the case management process, the initial step is A. Plan development. B. Service coordination. C. Intake and assessment. D. Discharge planning. 8. Which of the following is a core component of individualized written rehabilitation plans (IWRP)? A. Goals and objectives for employment. B. A list of hobbies. C. A medical diagnosis. D. Daily log entries. 9. Which team member is typically responsible for coordinating rehabilitation services? A. Occupational therapist. B. Psychologist. C. Rehabilitation counselor. D. Case aide. 10. Multiple sclerosis primarily affects A. Muscles directly. B. The peripheral nervous system. C. The central nervous system. D. Digestive system. 11. A psychosocial implication of spinal cord injury often includes A. Cognitive impairment. B. Increased mobility. C. Adjustment to loss of function and independence. D. Improved social support. 12. Which of the following is classified as a mood disorder? A. Schizophrenia. B. Bipolar disorder. C. Autism spectrum disorder. D. Tourette syndrome. 13. The Holland Code theory focuses on A. Labor market trends. B. Interest alignment with work environments. C. Wage expectations. D. Educational background. 14. Supported employment is designed for individuals who A. are seeking executive-level jobs. B. Have short-term employment needs. C. Require ongoing support to maintain employment. D. Are not motivated to work. 15. The term reasonable accommodation under the ADA refers to A. Job elimination. B. A benefit provided only to top-level executives. C. Modification that enables a person with a disability to perform essential job functions. D. Removal of all job responsibilities. 16. Confidentiality can be broken when a client requests it. B. A counselor is discussing with peers. C. There is a risk of harm to self or others. D. The client misses 2 appointments. 17. The CRC Code of Ethics emphasizes a. Rehabilitation through medication only. B. Prioritizing the employer's needs. C. Client autonomy and informed consent. D. Financial incentives for clients. 18. Dual relationships are considered unethical when they a. Involve family members attending sessions. B. Create a conflict of interest or impair professional judgment. C. Occur within agency staff. D. Are disclosed to the supervisor. 19. The Americans with Disabilities Act ADA was passed in a. 1973, B. 1990, C. 1965, D. 2001. 20. Title I of the ADA focuses on a. Transportation accessibility. B. Employment discrimination. C. Telecommunication services. D. State and local government programs. 21. The Rehabilitation Act of 1973 was the first to a. Provide housing assistance. B. Mandate equal employment for women. C. Prohibit discrimination on the basis of disability in federally funded programs. D. Regulate Social Security benefits. 22. Cultural competence in counseling includes a. Knowing all world religions. B. Speaking multiple languages. C. Understanding the influence of culture on the client's experience and decisions. D. Avoiding discussions of identity. 23. A culturally responsive rehabilitation plan must a. Ignore family input. B. Use standardized goals for all clients. C. Be adapted to reflect the client's values, beliefs, and background. D. Only include medical treatment. 24. Which population may face dual stigma in vocational rehabilitation? A. Veterans. B. Elderly clients. C. Individuals with disabilities who identify as LGBTQ+. D. Clients with chronic pain. 25. Evidence-based practice involves a. Using treatments endorsed by clients. B. Integrating research, clinical expertise, and client preferences. C. Choosing the least expensive intervention. D. Following traditional methods only. Certified Rehabilitation Counselor. The Certified Rehabilitation Counselor CRC test is a nationally recognized certification exam administered by the Commission on Rehabilitation Counselor Certification (CRCC). It evaluates a candidate's knowledge and skills in key areas of rehabilitation counseling, including counseling techniques, case management, disability legislation, vocational assessment, ethics, and psychosocial aspects of disability. Designed for professionals who work with individuals with disabilities to help them achieve personal, social, and vocational goals, the CRC certification demonstrates a high standard of practice and ethical competence. Passing the CRC exam signifies that a counselor is qualified to provide effective, client-centered rehabilitation services in a variety of settings such as healthcare, education, and public service agencies. Here are the top 5 beneficial uses of the sample exam. 1. Professional credibility. Earning the CRC credential demonstrates advanced knowledge and competence in rehabilitation counseling, validating your qualifications to employers, clients, and colleagues. 2. Career advancement. The certification can open doors to leadership roles in vocational rehabilitation, mental health, disability services, and government agencies by meeting recognized industry standards. 3. Compliance with state and federal standards. Many employers and public agencies require CRC certification for employment or reimbursement, ensuring legal and ethical service delivery across diverse client populations. 4. Higher earning potential. Certified professionals often receive higher salaries or are eligible for salary differentials due to their specialized training and certification status. 5. Expanded job opportunities. The CRC designation increases access to a wider range of employment opportunities in both public and private sectors, including rehabilitation centers, VA hospitals, and academic institutions.